Okay, welcome to Julie, Mums on a Mission. I am Julie Hatch, founder of Mums on a Mission, and welcome to this podcast episode. I have with me today a guest whose name is Sherry Amaral-Lopez, and she is going to be talking about autism. She is a mother of autistic twin boys who I believe now are in their early or mid-20s. So she has a lot of experience with them. She also does work with a local organization helping parents who have kids on the spectrum, which we'll talk about in just a second. So Sherry, thank you for being here. Welcome. I'm glad to have you. This is such an amazing topic, and I wish I could say more about it, but I don't. So I'm so glad that you're here to fill us all in and enlighten us and talk about autism, which is I think increasingly more common occurrence in today's kids.
It is, and honestly, it's difficult to keep up with the stats as far as the numbers. It is more pervasive in boys than girls, and typically girls, when they do get diagnosed, it's a little bit later than typically with boys, and it does present differently also with boys versus girls.
Oh, can you? Before we get into the meat of it, can you just sort of expand in what way does it show up differently in girls?
I think typically because of the way that girls socialize versus boys socialize. Typically, when boys are younger, it's more self-evident than girls. So typically they will get diagnosed earlier than what girls will.
Okay, all right, because of their socialization habits or ways of socialized. So can you, first of all, can you talk about, some people may know what is a spectrum disorder and what is the spectrum? That is sort of a hot phrase, the spectrum.
Yes.
Oh, he's on the spectrum.
Yes. It does encompass a wide array of different ways that autism presents itself, but the core symptoms are typically similar. Depending on the level of the child. They have changed the criteria. So currently it used to be Asperger's, which technically they've gotten rid of, but honestly, it's still kind of in like the medical world, they still use that terminology. Pervasive developmental disorder, not otherwise specified, which is PDD-NOS or autism. Currently it's the way that they are supposed to classify it. It's level 1, level 2, level 3 of ASD. ASD stands for autism spectrum disorder.
Oh, okay. So level 1 would maybe be Asperger's, even though it's not used anymore, and level 3 would be autism?
It would be more severe, correct?
Right.
The more challenging, yes. And then typically the core symptoms that it will affect on the child or the adult, because some adults actually get diagnosed older. So language and communication, social skills, self-regulation, the ability also to do self-care. And then there can be a behavioral component. Some children, when they're younger, will have stereotypies. Examples of this will be toe walking, banging on their chest, just like repetitive movements.
Okay. Yeah, when you say some people get diagnosed as adults, I'm hearing more and more stories personally of fathers who get diagnosed with somewhere on the spectrum once their child is diagnosed. And then they look back and they say, oh yeah, I guess I fit in with that.
Yes. And there definitely is a genetic component to it. Personally, for myself, I feel there was an environmental trigger in combination, definitely with a strong genetic component with autoimmune disorders in my family. And my sons were also premature, which there is a correlation with prematurity with developing some type of developmental delay. My kids were 31 and a half weeks before they were born.
Yeah, certainly I can see a developmental delay, but is there also a correlation between prematurity and autism?
There is.
Oh, okay. Huh. I didn't know that.
And honestly, it in part also with having multiples. It's not necessarily commonplace, but I'm finding just through like the different networks that I belong to that more and more parents of multiples are having children on the spectrum as well. And in part with the prematurity
Yeah.
factoring into that. I think that can be a key
Yeah.
issue too.
Huh. Okay.
Yep. And my sons are identical, which it's typically when they are identical, both of them will be on the spectrum, but I actually know families where identical twins, one is not on the spectrum. Sometimes that the second sibling may have, the way that I can describe it, autistic characteristics per se. They may have sensory issues, they may have some language delays, but they don't fit the criteria necessarily for a full diagnosis of autism.
That's, I think, really interesting. Identical twins. That's amazing,
Yeah.
I think. So tell me
Yeah.
about your story of what is your experience been as a mom raising two autistic children, twins, all at the same time.
Yes. So for myself, my sons were diagnosed, and they're going to be 25 this year. So a
Okay.
lot has changed, but honestly, a lot hasn't changed. I'm still amazed at some of the stories that I hear from other parents where they go to the pediatrician with concerns and they're told to wait. That it could be multiple factors why that child is not progressing, instead of assessing the child. And typically, if typically pediatricians, depending on their level of understanding, may not feel comfortable in doing the initial diagnosis, and they'll refer them out to a developmental specialist or a developmental pediatrician. But it's honestly disheartening at times to still hear that same story, because that's what happened to my sons.
Yeah.
They did have language, and then they did regress. So there was like a stop in language progression for them. Then the stereotypies started to come in, like the toe walking, the hand flapping. And when I tried to address it with their pediatrician, I was essentially told because of their prematurity, there would be potentially some developmental delays. Also, that because we spoke multiple languages in the house, that could factor into it. But my gut told me, like, no,
Yeah.
there's definitely something going on here, which again, I was told to wait 6 months. A month later, I was called the office for referrals to developmental specialists.
How old were they at this time?
They're about 2 years old.
Okay. Can you, so I sort of want to ask more about that, about what's happening now in terms of the diagnosing earlier, but can you talk a little bit about the characteristics? You were talking about hand flapping. I mean, it rolls off of
Yes.
your tongue, but can you sort of explain what the characteristics in your kids were that you saw at that age?
Sure. So as I said, they did have languages, they did have words, they were pairing phrases together. And I saw that there was a decrease in their ability to actually communicate comparatively to how they were communicating when they were younger. I should say, because they were premature, they were actually followed by an early intervention program and were released at 12 months because they had hit all the milestones. So between that 12-month period to about 24-month period, I started to see things, and in part, they were good eaters, like being Portuguese myself. Food is, they had quite the interesting food repertoire, very young, but I started to see where they started to have a lot of sensitivities. They developed a lot of rashes. They were diagnosed with psoriasis, a lot of like secondary medical conditions, like extreme severe GI issues. Also, looking back, I can see, because we did put them on specialty diets, they probably developed allergies to milk and to gluten, as well as having sensitivities to other foods, such as like soy, anything potentially that had additives.
Wow.
So once they were diagnosed, then it started me on a path of kind of looking at what would be considered alternative type of interventions. They did do pretty mainstream interventions, and I think it was honestly a combination of everything that really helped them.
So what was it, a combination of, what did you do?
So for my children, I did a combination of diet approach, of behavioral approach, but also looking at behaviors as a way for them to communicate. It wasn't necessarily just like, the tried and true approach to like behavioral intervention. And honestly, what in regards to that, what one approach worked for one of my sons wasn't so successful with my other son. So that kind of taught me early on, like even though they are identical, really it had to be an individual approach.
Yeah.
They do share, even to this day, similar interests, but they definitely are very, 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 very individual in things that they enjoy doing and people that they like to be around.
Yeah.
And at times, there definitely is a level of competition between the two,
Is
which
that
makes
right? Well, just like siblings, that's a normal sibling thing. I guess.
exactly. I honestly always say, Julie, their autism, it just magnifies who they are, like their personalities. It's just magnified. So it's kind of like interesting to see it in that way.
Um, so this may then lead into another question. You and I have talked a little bit about my approach, and what I try to teach and bring across is that every child should be nourished and raised suitable
Yep.
to their individuality. And I put it in Chinese medicine, their element types, and I talk about your element type, and you want to
Mhm.
feed that element and don't punish that element and help them to be who they are. Is that what you do also with autistic children?
Absolutely. I think, and that's actually one of my pet peeves in a lot of the way therapies approach, and honestly, even sometimes the medical fields. I think there's such a place for Eastern medicine bridging with Western medicine with our kids,
Yeah.
because they are very challenging, especially in the medical world. Um, And for my children in particular, as I said, one therapy, like one of my sons responded more so to hippotherapy, which is like horseback riding,
Uh-huh.
versus my other son. It got to the point where he was very clear in his communication that he didn't want to participate. So we stopped it with him. My other son enjoyed like art therapy. Even like the feeding interventions, like one of my sons had more GI issues, like with constipation, versus my other son was more loose stools, not to get too graphic, but
Yeah.
a lot of parents with autism do have, do deal with like the GI distress and food sensitivities. We were fortunate that even if you think about it, like it was, well over 20 years ago, I was fortunate, especially living here in Massachusetts, to have access to a lot of excellent programming and excellent people in the field. So we worked early on because one of my sons, when he regressed, he actually would self-limit foods to 3 to 4 foods, comparatively to what he would eat before, which honestly was not healthy. And that's not uncommon with kids with autism.
Yeah.
Their typical diet sometimes is honestly like chicken nuggets, French fries, mac and cheese. So that was something early on that I felt like strong about, that connection to food and healing. So
Yeah.
we worked with a food specialist that actually helped desensitize my son to smells within foods, because essentially that was his thing. He would smell it and then vomit.
Yeah. Wow.
Yeah, it was to that point. So very slowly, and with textures too, it was a combination of those things. Very slowly, we worked on that, and it took probably close to a year. And where whatever I would put in front of him, he would eat. There were times he wouldn't necessarily want to eat it, so I would kind of have to bribe him per se
Yeah.
with like
Ooh.
third item of a granola bar. But my goal was to get them to have an extremely healthy diet, and now they pretty much eat anything from actually today we had salmon with quinoa,
Oh,
which I would
wow.
consider pretty healthy.
Yeah.
I did have to do a little bit of bribing, or which again, my bribing is a yogurt with gluten-free granola, so
And they think
it's
that's
not
great.
what it's not what people may think. So
Yeah.
I think that, as I said, with them, I tried to take a very individual approach. It was difficult too, because a lot of the times they would be in the same classroom, but I always would suggest that they go in for inclusion or for different school activities separately, so they could start building their own identity and feel comfortable with, the twin not being there.
Yeah. Wow. What a proponent you are for them, which is another topic. Let me just stick for 1 second on the GI, because I and have learned, and I'm continuing to learn, that the gut as the second brain, the microbiome of the gut, is just so impactful in people's health, and they're learning health, and we're all learning more and more about it. You
Yes.
think that um, So do you think that certainly a diet can help with autistic behavior or a child on the spectrum? Changing the diet
Yes,
or,
I personally think as a parent, it's worth trying, whether for that child and depending on the family. My suggestion is because it can be done like the gamut of diets with my sons now. Pretty much, my thing is clean eating. We do limit because they at this point they have more sensitivities versus a true allergy to certain things,
uh-huh.
which I think in part is from years and years of being on it. What I do know is when they go off diet, you will see the GI distress immediately.
Uh-huh.
But I do definitely feel it's important for everyone, to be honest, not just, kids on the spectrum or adults on the spectrum
I
to,
completely,
yeah, because
sorry.
that I think that's okay. That truly, I think, helps individuals to honestly manage inflammation in their bodies. I mean, it's not just necessarily correlated to people with Crohn's or colitis or other um, diseases in the gut. I think
Yep.
people would be amazed. Yeah.
Yeah,
If they were,
leaky gut is a big problem and can contribute to all kinds of, even just a bad mood can be, I think,
yeah.
attributed to a leaky gut, perhaps. So
And that's what, oh,
sorry,
I'm sorry.
go ahead.
I was just going to say, and that's what a lot of individuals, I always, especially when a child is having a behavior that doesn't necessarily have a direct correlation to something that you could pinpoint, I always suggest that they rule anything out medically, especially kids with more communication challenges or language challenges. They may not be able to express it. But one
Hmm.
of the things with my sons early on that, and then I actually read a study, which I was amazed. It was truly that connection for my children. A lot of kids that toe walk, it's actually GI distress.
Yeah,
They're whatever it is that's happening exactly what we said with the leaky gut, and they're not able to communicate that. But it was amazing, like the difference in their ability to actually process information and attend therapy sessions that just making that tweak and changing the diet made for them.
wow.
And I actually got comments from the school asking me like, what is it that we had changed? What is it that we were doing?
Yeah, that's great. So I want to sort of move into what an advocate you are for not just one of your children, but two of your children who are different. What has it
Yep.
been like to be such an advocate? What would you say to parents that are starting out on the journey of finding out that they have a child on the spectrum?
I say this to both parents, but historically, moms are usually the ones who are on the forefront of navigating the medical system, the school system, anything that they're doing is trust your instinct. If something just does not feel right for your child or your child is demonstrating to you, even though it's quote unquote what you have been told should be like the next step, then always trust your instincts when it comes to your kids. And
Yeah.
honestly, I think it's for all moms out there. For myself, I had a couple of experiences where, and this was interesting when I went to a world-renowned hospital and was trying to speak to a dietitian about dietary changes and was completely, what's the word I would like to say? Um, Dismissed is a good word
Uh,
in my concerns. And then when I actually did specific testing and they actually had colonoscopy and it came back that they had severe inflammation. And I knew like absolutely something was going on with them in the GI system just because of the way that they would, present and, them being the physical symptoms, being uncomfortable, having, some of the loose stools, the constipation. I knew to trust my instincts. So I just essentially picked up my children with my husband and said, thank you for your time, but clearly we're not connecting here, and walked out.
yeah,
Um,
that's a bold thing to do. People, I think, are so, well, can be, and maybe it's changing, apt to turn over not their power, their intuition, or yes, their power as a parent to the people in the white coats, thinking that they know it all, they know best. And sometimes maybe they probably know what the parents don't know, but a lot of times nobody knows their kids better than a parent does, I think.
yes. And I do think, as I said, I am a proponent because I do believe that there are pros for Western medicine, but I think, especially with our kids, that it needs to be a more broader approach to helping them and supporting them.
Yeah.
I think sometimes, and to be fair, from what I've been told, what Western doctors are trained to look at in their course of education is not necessarily the whole picture of the child. It's just to treat whatever symptom it is versus
Yeah.
getting to the core issue per se.
Yeah.
But I think I'm seeing more and more doctors kind of be more open-minded to looking at other approaches as well, and honestly looking to the patient. And that's kind of the other important thing is look to your children for their ability to show you what it is that they're interested in. Because sometimes as parents, we have like a to-do list as far as what we feel or what we've been told should be the next step. And then we're told if that child doesn't hit that milestone by that certain time frame, that they'll never reach that milestone, which is honestly a lot of BS because our kids are lifetime learners, just like we are. So
Yeah.
while they may not fit into that box of learning that skill set at that age, it doesn't mean down the line they won't learn it.
Yeah. Good point. So they sort of travel along the developmental milestones at their own pace. All kids at their own pace.
Yes. Yes. And that just speaks to they just need a certain level of supports in order to be able to gain that skill.
Yeah.
To reach that milestone. Yep.
Yeah. So you want to look at sort of the, like you were just talking about, the holistic, the whole child. You want to look at the big picture and not just, are they walking at age such and such? Are they speaking at such and such? It's the bigger picture, really, right?
Yeah. I think that's the most disheartening thing, especially when you have a child that's so young, being told, if they don't speak by this age, or they know, they can't necessarily ride a bike by this age, or it's just, to me, it's an odd approach as somebody who's supposed to be like in the healing field as, a practitioner, to tell that to a parent. I think, you can phrase it like probably a little more empathetically and say, this is typically what we see. That's not to say your child, will experience this.
Right, right, right. I think that you have said, well, a couple more things. So for one thing, you obviously have a good sense of humor. I'm sure you've had to maintain a good sense of humor during these 25 years. What would you tell moms about, or how did you make, let me start off with, did you make caring for yourself a priority, which I can't imagine having the time to do that with such a handful of 2 autistic children. But did you make self-care of yourself? Well, you look like you've weathered through this really well. And like I say, you've got good humor. So how did you do it? What did you do for yourself?
Well, to be honest, I learned from other parents early on that I should not be my children's sole world, because at some point, as a parent, clearly it's just the evolution, I will not be here. So it was important for me to build a support system that would allow me to feel comfortable to leave my children. And that was a big thing. I was fortunate to have family that really made a big difference.
Yeah.
In regards to that, I know some families don't, but there are definitely other avenues, to explore for that. That was a big thing because burnout, and I know we've talked about this, caregiver burnout is a real thing. And it's important for especially moms because things tend to kind of be placed upon us to actually give yourself permission to do those
Yeah. Yeah.
individual things. And for some families, honestly, I mean, some moms, it's even 15 minutes a day, like taking a cup of coffee, going out on the deck and just like, taking that time. For some families, it's more challenging depending on, the child,
Yeah.
especially with like the siblings. COVID has been a whole other layer of this between the children being homeschooled and the parents trying to, either work remotely themselves. Personally, myself, I've experienced that. We were
Yeah.
fortunate. We do have one staff person coming into the house to kind of help with that too. But I mean, it is true, like the old adage that they say, if you don't take care of yourself, you're not going to be in a place to take care of anybody else. It's like that, oxygen mask falling. So I've now made sure I've learned that lesson to the best of my ability and make sure that I do make myself a priority.
Yeah, that's good. Mothers are often the last people to ask for any kind of a help. They'll always take care of everybody else before they take care of themselves. And that's,
Yep.
I don't know what it is. Is it in our X
So,
chromosome? I don't know.
Well, I think as a society, and again, even, I think I was reading a study where they were saying statistically, women are not returning to the workforce as men have through COVID, which is going to be interesting moving forward, how that's going to impact like the workforce, but it's also like the family life. Because I think ultimately, if something can't be done, it's put on a woman's plate and somehow we make it work, like to get
Yeah.
that done.
Yeah.
But I don't think it's okay though. I don't think that should be the case. As I said, I am very fortunate where I do have a strong support system, and that's made a huge difference, especially having twins. But in
Yeah.
part also, it's giving myself that time, and it's all whatever works for that family. For some moms, honestly, if you're not into like massage therapy, or I mean personally like things like that, I love a manicure, I love a pedicure. Honestly, sometimes it's just getting out of the house, going down the road, going into a parking lot. If you're into reading, just getting away sometimes, if that's all that can be done, or as I said, even your backyard, whatever
Yeah.
works for you as a mom. But
Yeah.
definitely building in that additional time,
Yeah.
whether that be.
So at one point you talked about your kids being in different, you wanted them in different classrooms because to have their own separate identity. Did they go to school? Uh-oh.
Yes,
Yeah.
so
Okay.
there was actually one particular year which the we weren't really sure if the program was the best for one of my sons, so they did go. I think it was like 6 months. They were separated at a different school, and then we quickly realized that second school wasn't necessarily the best. So what I proposed was actually, and the school agreed, was having them split their schedule. So when one was in the inclusion setting, then the other one would be in the specialty setting, and then they would switch. That seemed to work better because it was interesting. As I said, my sons do have definitely a competitive edge,
Yeah.
and but there's definitely like an intense connection there and a love, because I was told that they would actually, when the other one would walk into the classroom, and this was like preschool through elementary school, that they would get up and like look to see, like instinctively they knew that the other one was there. Does that mean they'd want to sit next to their brother? No.
Right.
That means they just, so, but at the same time, I can understand, because honestly, like with the twins and they're identical, being together 24/7, like at school and then home. And that was one of the things that when I started to explore different interests for them that they could approach,
Yep.
and participate in.
So now at the age of 25, what is life like for you and them? Are they home all the time? Do they go do anything outside of the home? Do they go to school, training? I don't know.
Well, in part because of COVID, they've been home for the past, it's a year and a half. I guess like everywhere else, because of staffing concerns throughout the state. From what I read, also there's staffing shortages, so that they're not at capacity. And my children, because of their medical history, we're not doing the COVID vaccine. They have also developed puberty onset seizures, grand mal seizures. So we discussed it with his neurologist, and I'm just at this point not comfortable with them getting the COVID vaccine. He did have several patients that actually had breakthrough seizures as well.
Wow.
So their program is not requiring vaccinations at this point for individuals that they support. So we've been told when they go back, they'll have to wear a mask. Thankfully, they do wear a mask. We've actually practiced with them, and in part because of their autoimmune issues, we haven't fully reintegrated. Like a lot of people have, especially this summer, like going to family functions and things like that. But I guess one of the positive things is the activities that they do enjoy doing, we can still access. So they're going still for car rides, that we walk as much as possible.
Yeah.
They both enjoy watching the Food Channel.
Uh-huh.
One of them will, go on YouTube and look at different things. My other son likes magazines. And it's interesting enough, we've noticed a gain also in skill sets with being more independent at home. I think in part because some of their anxiety with being outside of the home and what that entails. One of my sons also is very auditory defensive. So he wears noise protection headphones.
Yep.
So I think for them, it's the schedule is the same.
Yeah. Yeah.
So they're like, oh, goody, we get to do more of the stuff that we like. But I am starting to see a tax on them a little bit more.
Oh,
But
yeah.
I mean, considering that, honestly, I think on everybody, but
Yeah.
considering the amount of time, like up until this point, I think they've done remarkably well. And when I've discussed it with their specialists, they've actually said, yeah, that's quite
Yeah.
amazing.
Yeah.
So our plan is transitioning them back probably at some point this fall, slowly, to kind
Wow.
of reintegrate them into that routine.
Yeah. Wow. Um, we were going to do this in April, which was Autism Awareness Month, and that didn't work out. But what could you say? What is society's responsibility, or us lay people responsibility, for including kids, people on the spectrum who are becoming more and more of them, accepting them, their differences, and including them, and not thinking that they're so different, and I don't know. Could you understand sort of what I'm saying? What can we
Sure.
do as a society to make it better and easier for the families?
I think in general, honestly, Julie, you actually hit the nail on the head, because we're like, April is Autism Awareness Month, but I'm at the point, and again, I think just as my children get older, I would hope that the awareness would be there. But I've had experiences where, to me, it's quite evident that my children are on the spectrum, and somebody still, I'll get a look, or something will happen. It's actually kind of interesting, but also kind of odd to me. For myself, I think like autism awareness should be all about acceptance, and not just kids on the spectrum. I would hope as like a society, the
Yeah.
direction that we're moving in is about accepting everyone, because we all have challenges, we all have differences. And I think it's also important to fund on a state level and a federal level innovative programs that help individuals on the spectrum, because typically the supports that are required, it needs to be more individualized in order for them to be successful.
Yeah.
It's not a cookie cutter approach that works with our kids.
Yeah. I think that that's
And it
true.
needs to be specialized. Oh, I'm sorry.
Specialized. So you just said needs to be
Like
special.
like specialized services in order for them to be successful. So that could be a mentor that has direct experience, or potentially would need training to support an individual. And when my children were younger, what would happen a lot is, because they don't present with any type of physical differences,
Yeah.
it would be until they actually would have like an outburst, or because they do like this vocal play, that I would, and again, some people were just inquisitive, not to say that it was anything, because I think that's a natural human reaction. You hear something different, you look, but there are other people that weren't so nice. So in part, what you were talking about earlier, I learned early on how to choose to educate which individuals, because depending
Yeah.
on my mood, they either got a mouthful with like instruction cards saying, this is why my son is doing this, stop staring, or I took a more I guess more friendly approach to help them understand.
Wow. You're amazing, Sherry. You're amazing. And you help parents that are going through this, or that are having to work with kids on the spectrum. You do great stuff. So your kids are doing okay now. I understand COVID throws a
Yeah.
whole monkey wrench into things.
Yes.
Yeah. So are they do they communicate well? I understand you said they have not tantrums. I can't remember what the word is that you use, but I was picturing
Well,
like
it's just dysregulation for kids. So what happens for a lot of, this is the way I try to explain it to parents. Imagine yourself, you wake up, you're late for work. So that already puts you in that negative space. Then you go downstairs and there's no coffee. You go you go to the fridge, if you whatever take, whatever put milk or almond milk, whatever, in your coffee. And guess what? You see your kids sitting there eating it with their cereal. Then you're like, okay, kids, all right. So you don't know that's part of your routine. You don't get your morning coffee. You didn't get your almond milk in your coffee. You go out to your car. Well, there's no gas in that car, or you don't have enough gas. It just builds up on that. So with our kids, especially with kids with communication challenges, you may not realize they're at that breaking point per se, and then they'll have an outburst, or they'll yell or get upset about something. And while it may not have like a direct correlation to something, if you can take the time to kind of step back and look, then typically there is. But it's challenging because if they don't have the good communication skills to express that, or even have memory recall for what it is that potentially was a trigger for them,
Yeah.
it just seemingly looks like this adult had
Yeah. Yeah.
on her first, but that's not the case.
That's really interesting because it fits again right in with, I think that all behavior, and I'm talking about children that are not on the spectrum, behavior comes from something inside of them. It's not, and maybe the parent can figure out what it is that triggers them, and maybe they can, especially if they're pre-verbal or not verbal, but there's always a reason for it. And it behooves us to have, I know it's easy for me to say, to have the patience and the wherewithal and to dive in and try to figure out what's driving the behavior. And that's simple. You have it 10 times more complicated.
It's interesting because what I noticed too, and talking to other parents, there definitely are patterns there with certain things. And there's something, I think with all kids, but more so with our kids on the spectrum, this, depending on, let's say there was a situation that happened, that there was like a negative result for that, they associate that same experience. So let's say they went to a water park and it was like a crazy sensory experience for them, that they had a meltdown. So even potentially being near like, let's say a pool, like if they went to a birthday party or something like that, and they saw that, it's almost like a trigger for them.
Yeah.
And without them having communication skills, they won't necessarily be able to understand or to express that, even for themselves. That's why I'm a big proponent of, my children use an iPad to communicate. They do have some words, but typically people that work with them pretty quickly, I've been told they're pretty expressive, even though they don't have full language per se. So between the iPad and a lot of it too is just their eye gaze and just gestures and that type of nonverbal communication. People that work with them typically can ascertain what it is specifically that it is, but that was a concern of mine.
Yeah.
Early on, I was told to have them, which they did learn signs, but typically our kids are taught approximations of the American Sign Language. So my concern was if they were ever out in the community and that person wasn't fluent in American Sign Language, what would that do to help my children? So initially they used pictures. So now they use a combination of pictures and words with their communication system, Go.
Wow.
So that's been probably the most effective way for them to communicate. And again, they're great at like the nonverbal gestures as well too. And once somebody works with them, then they understand them pretty well.
Yeah. Wow. What a life you have had. We're going to wind down, but I just want to see if you want to add anything about your children, about your experience for other parents, anything that you want to add that we didn't cover or that I didn't bring up.
I guess for myself, I always tell parents that, especially when you have kids on the spectrum, but also honestly kids with challenges, to think of it as a journey, not a race, because sometimes it's just like initially getting through whatever it is that you're going, like whatever challenge or situation could be with your child, but typically there's always a light at the end of the tunnel. So sometimes it's day by day, and that's how you get through like those more challenging times. And with our kids, in part, it is a spectrum. So you'll have those, honestly, sometimes months and months of things where seemingly coasting, and then you'll be like, oh boy,
Yeah.
Something will happen that you'll be like, okay, so just remember, you're going to get through it. Like, even though it doesn't, depending on the challenge, in that mindset, for myself, it's all about trying to keep a positive mindset through everything.
Yeah, I can see that you're good at that. That's a good message because it is a long journey and you certainly can't sprint it. It's not a
Yeah.
sprint race.
No, and as I said, sometimes it's just getting through that day, and then that day builds to the next day, and then you can reflect and look back and be like, when my sons were younger, I actually would keep journals of different things, and I'd be like, "Oof," like that. That was an experience, but on it, a lot of the times it taught me for the next, and especially with like the self advocacy thing for
Yeah,
them. And
yeah,
they do teach me a lot because initially I would get very, very involved with, like, especially during certain staff changes that I didn't feel that person had that expertise or necessarily wasn't a good match. And my sons taught me to kind of step back and let them show me if that was in fact the case or not.
ah,
And sometimes it was, and sometimes it wasn't. So I would
uh-huh.
just be like, because I mean, our kids have amazing instincts too when it comes to people that support them.
Yeah, I'm sure.
Mhm.
Wow. Well, Sherry, thank you so much. This has been really, really informative, and good luck with you and your kids and all of the great work that you're doing. And maybe we'll talk again sometime.
Okay, great. Thanks so much. I so appreciated the opportunity too.
Thank you. This is Julie Hatch with Mums on a Mission.